Thank you, Mr. Chairman. Thank you. We all know that one way to get the cost of health care under control and to improve quality is to change the way that we buy care. Instead of charging for each test, for each procedure, for each follow-up visit, we need a better way to pay. Now, Secretary Burwell has set the goal of transitioning 30% of Medicare payments away from fee-for-service by the end of 2016. One alternative payment model is bundled payments, a lump sum payment that covers all the costs of a procedure and the follow-up care. For example, Baystate Health in Massachusetts has been bundling payments for hip and knee replacements and the necessary follow-up care for years. And it has improved quality and saved an average of $2,700 per patient. The data are clear. Bundles can help us move toward better outcomes at lower costs. And it's good to see that CMS recently announced their intent to use bundle payments like Baystate's in 750 hospitals across the country, starting next year through the Comprehensive Care for Joint Replacement model. Dr. Conway, can you explain why interoperability, making sure that the electronic medical records can actually talk to each other, is important to facilitate alternative payment models like bundled payments?
Yeah, Senator Warren, thank you for the question, and familiar with some of the work in Baystate. Was in Massachusetts last week, and just tremendous work. On bundled payments and interoperability, thanks for your comments on comprehensive joint model. We're very excited as well. We're getting comments and rulemaking now. I'm actually this afternoon talking to hundreds, and we actually have over 1,500 providers in our voluntary bundled model. And hip and knee replacement is actually the most common condition. Interoperability is a critical underpinning. So the key to effective care, as you know, in these bundled payment arrangements is to truly coordinate care for that patient for the entire episode. So what we hear when we interact with providers in bundled payment is they're sharing information from the hospital to the physician group to the post-acute care provider, even home and remote monitoring technology. So some of them are very successful by getting patients in their home and then caring for them in their home, which is a lower cost setting and generally patients prefer. So I think the interoperability piece is critical to the success of bundled payments. And as you said, we believe bundled payments are a critical piece of the overall picture of alternative payment models and delivery system reform.
Thank you. That's very helpful. Now, you know, this is the 6th hearing that this committee has held on health information technology. And one point that I think has come across in every single hearing is despite the success of federal incentives in getting doctors and hospitals to implement electronic health records, most still can't exchange basic patient information. So, Dr. DeSalvo, the Office of the National Coordinator for Health IT is charged with advancing interoperability of healthcare technology, which, as Dr. Conway said, can help advance alternative payment models. Is the reverse also true? Do payment models that require cooperation across care settings help promote interoperability?
Senator, it is absolutely true that moving to a changed business environment, moving to alternative payment models, ones that reward value and population-based care, not only requires us to have a health IT infrastructure that works, that provides the data necessary to the docs and the hospitals and the other care team members and the consumer to know what information is there so they're not doing redundant tests, and that they're able to save money, reduce harm, and improve the quality of care. These two concepts are so tightly linked. It is one of the reasons that the department's delivery system reform effort has them so tightly linked, that we want to change the way we pay for care and deliver care, but it requires a new information model that we want to advance. And system after system that's highly successful, whether it's in Massachusetts or I was just at Intermountain yesterday, they can show you clearly that when they have better data, they have a better dashboard, they know where they're going, it helps them to reduce costs and improve quality.
Thank you. This is very helpful. I fully support CMS moving forward with the mandatory joint replacement model. You know, the Congressional Budget Office estimates that widespread use of bundled payments could save our healthcare system $46.6 billion. but we need to continue to build interoperable health IT infrastructure in order to realize those savings. And that means setting common standards for transferring information and developing a way to accurately link medical records to patients. It also means creative incentives that encourage information sharing. Like Dr. DeSalvo and Dr. Conway have said today, alternative payment models are one way to create those incentives. So moving forward with these new models and improving interoperability go hand in hand, just as you've said, tightly linked. I hope that the Office of the National Coordinator, CMS, and this committee will continue to coordinate on these initiatives so we can move toward a healthcare system that gives us better outcomes at lower costs. Thank you, Mr. Chairman.